To make the transition easier, the city handed out free surgical masks to businesses today. The idea is to have something on hand to offer customers who show up without a face covering. The increased contagiousness of Omicron is putting fresh focus on mask wearing, and we've been getting a lot of questions from you asking if the mask you have will keep you safe. So we took your questions to the experts to get answers.
I thought I heard him say it was one of our best lines of defense when we're out in public, especially in crowded indoor spaces.
Charlie LaFlame has the same question as many of you. Will my mask protect me from catching or spreading COVID-19?
I thought these filtered out a good amount of the aerosol particles that carry COVID-19.
We took your questions straight to the experts. Maine CDC Director Dr. Nirav Shah, Dr. Lori Banks, an assistant professor of biology at Bates College with a PhD in molecular virology, and Dr. Gavin Ducker of Northern Light Health. Here's what they said.
So the most effective would be the KN95s. And so that's what we've switched over to in our household. That would be like your go-to if you can get a hold of those. Next to that would probably be the surgical masks, the little blue ones that are single use. And then if for some reason you can't get a hold of one of those two, I would double up on whatever else you have.
I wear a surgical mask. According to the US CDC, the manner in which these are made, the fusion of various different layers provides maximum filtering. And so when I talked last week about upgrading your mask, what I was really focused on is moving away from the neck gaiters and handkerchiefs toward either a multi-ply cloth mask, but even better, one of the standard surgical masks.
Two important things to note. One, the mask must fit well. You want to avoid any air escaping from around the edges of the mask, near your nose, cheeks, or chin. Two, blue surgical masks and even KN95s are meant to be used once, not several days in a row.
No.
Can you explain why?
Particles within the mask start to break down, and those are designed to be single-use masks. And so it just doesn't have the integrity that it did for the ability that you need it for to hold things away from your face.
Masks, as you know, lose their efficiency once they become wet with moisture from the breath, and that tends to happen quicker with the cloth masks. So they tend to lose their effectiveness efficiency earlier in the day.
So again, those KN95s and N95s have the highest levels of protection, followed by surgical masks. Now, if you buy these at a hardware store and see the words non-medical printed on the box, Dr. Banks says, don't worry, those are still okay for use in the general public.